Greetings and salutations, everyone. I'm Dr. Christian, General Practitioner with the Health Services Authority right here in the lovely district of West Bay. I'm just here to talk a bit about the vaccine. I keep things simple. I will first share my personal reason for getting the vaccine, and it simply is that all around me geographically, I have a family. I have my parents in Jamaica, I have brothers in the States, and the truth is, life is about family, and I would like to go and visit them. And I would like to be safe, or at least increase my chances of being safe. And that's the reason I personally have gotten the vaccine. I would like to go visit my parents, know that I have a reduced chance of contracting the virus when I go to visit them, and likewise, or as a follow-up, not transmit it to them. So my personal reason is to reduce the chance, an extra level of protection for me as an individual from A, getting the virus, and B, in the odd event that I'm unfortunate to get it, data definitely shows there's a much greater chance of me not ending up in a hospital. And then thus I would not transmit it either to, as I said before, my parents or my relatives in the States. So that's my personal reason. And so my advice, because in life we all have to make decisions, is simply to follow our conscience. And if we follow our conscience, what we should do is we should A, pray on the subject at hand, B, seek the advice from our elders, from those in the field who know about it. And if we do that, we ourselves think about it, we'll come to a decision. All of us will not come to the same decision, but if we go through that process, at least we're going through a process to make that decision. So I implore everyone, pray on it, A. B, seek out the advice of those in the healthcare fraternity, whether it's coming to the clinic, whether it's talking to your doctor friend, your doctor neighbor, your nurse friend, your nurse neighbor. Arm yourself with different people's opinions in the field, and then you come and you make your decision. So when making this decision, I like to liken it to a decision with a car. Most of us drive cars or take cars. So let's say there's something wrong with the car, so we need to get it fixed. Are we going to go to the grocery store or to the bank and ask them, what should I do with the car? No, we go to the mechanic, hopefully. And we wouldn't go to one mechanic. Get to first, get an opinion. If we doubt it, we go to the second, we get an opinion. We may go to 3, 4, 5 different mechanics to get an opinion. The point is, we're going to someone in the field who knows about cars to get their opinion. We're not going or getting an opinion from someone in the banking or in the catering business and then taking it for gospel. And I feel that is what is happening a bit with the whole vaccine misinformation. We get information from the caterer about our car and we hold on to it. If the caterer wants to give us information, fine, listen. But at least then go out to the mechanics and get their opinion. So go to the doctors, who is the mechanic of the body, and get our opinion. And so, with me having said that, the reason I am here is because we in Grand Cayman were blessed. We have an abundance or an excess of the vaccine. Unfortunately, it expires the end of June, which means we need to get that first shot in by June the 9th. It would be a travesty if our neighbors geographically around the world are clamoring for the vaccine, cannot get the vaccine, and we here are sitting on excess and will have to dispose of excess. I think it's a human travesty if that happens. So I implore everyone, pray, speak to the physicians, speak to the nurses, speak to yourself, and come up with a decision.